because I think that might be our best. And I might talk kind of loud just because I know that it's not the best volume here. And then let's just get this one going also. Okay, so knock knock.
Man.
Hi Sheila.
Hi Kai.
My name is Kai.
Hi, Kai.
I'm a student here working, a nurse practitioner student here working at Gonzaga, and I'm just going to come visit with you about your abdominal pain, okay? Just sit here first. So when did it start?
Well, I had about a year ago, but 2 days ago I was at work. I work in a lab doing urine and handling urine and blood samples.
Okay.
But it was so intense, I had to leave work, and then the only thing that helped was to lay down, and it lasted for about 3 hours, and then it was gone.
Okay, so you left work and you lay down and it went away.
Mm-hmm.
And so tell me a year ago what happened.
The same thing.
Okay.
Just this intense burning upper abdomen pain.
Okay.
And
Mostly described as burning?
burning.
Burning, okay.
Mm-hmm.
And is it right here you're pointing? Is it just
Yeah, it's up here and then
kind of
right
radiates
over
over
here.
that way?
Yeah.
Okay. Does it ever go up into your
No.
back or your,
Mm-mm.
or in your shoulder or anything?
Mm-mm.
Have you ever felt pain like this before?
Just that one
Besides
other time,
just the
but
one
other
year?
than that, no.
Okay. And this time you said it lasted about 3 hours?
Mm-hmm.
Is it about the same a year ago?
Yes.
3 hours?
Mhm.
Does it just stay constant then, this burning for 3 hours? Okay.
Mhm.
Have you noticed, does anything seem to make it worse?
Well, I mean each time it happened, about a half hour after dinner,
Okay.
lunch, so,
And
or eating something.
something after you ate it, half hour usually?
Mhm.
Okay. And then, have you tried anything for it? Have you tried any
Just
treatments?
Laying down.
Just
and
laying
resting.
down. Okay.
Mhm.
Have you noticed anything that makes it better?
Mhm.
Just the laying down
Mhm.
and that goes away. Are you having any other symptoms with it? Like, have you had a fever?
No.
Do you get nauseous or?
I was very, very nauseous, but I didn't throw
Okay.
up because I won't let myself throw up. But I was very nauseous, and then once the pain went away, I was able to feel better.
On a pain scale with 0, no pain, and 10 is the worst, where
Probably 8 to 9.
all the way up there, huh?
Mm-hmm.
And did you take
Just
any
burning.
medication at all for that?
No.
Okay.
Mhm.
Are you in pain right now?
No.
Okay. How has it affected your diet at all? Are you able to eat okay?
I am.
You are?
I am. Yeah.
Okay.
Yeah.
Do you eat a pretty balanced diet? Are you?
Usually I do. I mean, because I started keeping track of what I was eating.
Oh, good.
And so, let's see. I was trying to remember back the day that I was working. I went through McDonald's and got an Egg McMuffin and some of their coffee, because I really love McDonald's coffee.
Okay.
And then for lunch, I remember having a hamburger with fries and a Coke.
Okay.
And I know Coke's probably not the best thing, but I just needed some of that pep me up. And then after I went home, I remember my boyfriend made me some mac and cheese, which was really easy to eat for me. And then I had some milk, green beans, and some ice cream.
Okay. Is that usually like a typical meal
Yeah.
for you? Is it? Okay.
Mm-hmm.
And has this affected your energy level at all?
Well, I mean, I have a new baby at home, 5 months old, so I am tired all the time.
Okay.
But other than that, no. Mm-mm.
A 5-month-old baby?
Mhm.
Congratulations.
Thank you.
That's good. Do you have a boy or girl?
I have a boy.
Okay. And so you said you work in a lab.
I do.
And you work around urine mostly, or just
urine
that day?
and blood.
Okay.
Mm-hmm. I just run the samples. So.
Okay. And how long have you been doing that?
5 years.
Okay. And how has work been besides this day? Have you been able to go
Yes.
to work just
Yeah.
fine? Okay.
Yeah.
Have you seen anybody else for this pain, or is this the first time you've come in?
First time.
Okay. Has it affected your sleep at all, or do you sleep okay?
I seem to sleep okay. My sleep's interrupted. I mean, I get 7 to 8 hours of sleep a night, but my sleep is interrupted from my little guy.
Your
But
baby?
other than that, it's
Are you breastfeeding your little baby?
No, I'm not.
Okay. But he still wakes you up and
Uh-huh.
needs you, huh?
Mhm.
I'm just going to ask you some histories about,
Sure.
or some questions about your history. So tell me your medical history. Do you have any medical history? Asthma, diabetes?
No, nothing.
Allergies?
No, nothing.
How many children do you have?
Just one.
One little boy?
Uh-huh.
And he's 5 months old.
Yes.
Okay. Have you ever had surgery?
Never.
Did you have a vaginal delivery?
I did.
And was
I
he a
did.
term baby?
Yes.
And everything was okay
Yes.
and good?
Mhm.
Okay. And you just chose not to breastfeed, or?
I did.
Okay.
Um,
Have you ever been hospitalized for anything?
never. Mm-mm.
Have you ever had any injuries or an accident, any broken
No.
arms, or any trauma anywhere?
No.
Okay. What about your family history?
Um,
Your parents and your grandparents?
well, my mother has high blood pressure. She's 52.
Okay.
My father died of a heart attack when he was 57. Let's see, my maternal grandfather, he also died of a heart attack, but he was 75. You know, he had a good life.
Okay.
My maternal grandmother, she died of pancreatic cancer when she was 71.
Okay.
My paternal grandfather was an alcoholic. Same with my father was an alcoholic. He died of alcoholism, my grandfather did.
Okay.
And then my paternal grandmother, she has cirrhosis, but she's still living.
Okay.
But other than that, that's it.
Okay. So, no diabetes?
No.
Colon cancer?
No. Just the
um,
pancreatic cancer.
Just the pancreatic, and then stroke, and no breast cancer?
No.
Okay. Are your immunizations all up to date?
Yes.
You had a hepatitis
Mhm.
series all
Yep.
done?
Yep.
Okay.
Yep.
And when was your last pap smear?
4 months ago.
Okay.
Mm-hmm.
So and was everything okay there?
Yes.
Have you ever had an abnormal pap?
No.
Okay. Have you ever had a mammogram?
Not yet.
Do you do your own breast?
I do.
Self breast exams? You do?
And nothing's ever quite, I've never felt anything or
Oh,
questioned
good.
anything.
How often do you do them?
Well, now that, you know, I've been so busy with the baby, but I try to do them about every 4 or 5 months.
Okay.
Mhm.
And are you taking any medications right now?
Just my birth control.
Okay. And what kind of birth control are you on?
Orthonovum 777.
Okay. And that's a once a day pill?
Uh-huh.
Okay.
Mhm.
And do you ever take any medications, ibuprofen or aspirin or anything for any reason? And you said you didn't have any allergies
Nope.
to any medications. Do you
Nope.
have any food allergies or environmental?
Mm-mm.
And do you drink alcohol?
Well, I have wine. I like wine.
Okay.
I usually have, 5 to 6 glasses of wine a week. Hence why I'm not breastfeeding.
Oh, okay.
Yeah, because I knew I didn't want to give that up.
Okay. And so do you have like one glass when you do have your 5 to 6 glasses a week, or just sometimes you have like 3 glasses a night and then other times?
I have 1 glass.
One glass?
Mhm.
Okay.
Mhm.
And do you smoke at all?
Not tobacco, no.
Okay. Do you smoke marijuana?
Every once in a while, my boyfriend and I do.
Okay. So you have a boyfriend?
I do.
And how long have you guys been together?
4 years.
Okay. Do you feel like you're in a safe relationship with
I
your
do.
boyfriend?
Mhm.
Okay. And he helps you with your new baby?
Yes.
And he's a good dad?
Mm-hmm.
Good. So, and how much marijuana would you say you smoke?
A couple times a month.
Okay.
But we don't do it around the baby. You know, I
Okay.
really make sure we don't do that.
And do you do it for any type of medicinal reason or just
Mhm.
recreation?
Just recreation.
Do you use any other recreational
No,
drugs? Have you ever used any
Never.
like IV drugs or
Mm-mm.
anything?
Mm-mm.
And you said you drink coffee.
I do.
How much caffeine do you usually have a day?
Just 1 cup a day.
1 cup.
Mm-hmm.
Is there any chance right now you could be pregnant?
No. Mm-mm.
And how do you
Sure.
know?
Well, I'm still having periods, although they're lighter.
Okay.
You know, my periods are lighter. And actually I didn't have a period last month, but I don't feel pregnant. Pretty sure I'm not pregnant.
Okay. Have you taken a pregnancy test at all?
No.
Okay. And have you been taking your pills regularly?
Yes.
Okay. Do you have any new stressors in your life at all besides your new baby? Okay. Not that that's much stress, but you know. And so let me just kind of ask you more questions here. Have you noticed any weight changes? Have you had any?
Well, I've lost 15 pounds, but that's just, I've been trying to.
Yeah, okay.
From the baby, but no other weight loss. But
how are you trying to lose your weight? What do you do?
just exercise.
Okay,
I've been
good.
trying to exercise. But the day that this pain happened, I wasn't able to do my exercise. I was so nauseous with it. I couldn't, the only thing I could do was lay down.
Okay. And so do you do anything else to?
No.
So exercising, do you walk, run? Just do all different
On my
kinds of things?
treadmill.
Okay.
Mm-hmm.
Have you noticed any like fever?
No.
Have you had any fever? Any increased tiredness besides,
Mm-mm.
you know, what's normal with having your baby?
Mm-mm.
What about like any chills or night sweats?
No.
Okay. And what about on your skin? Have you noticed any lumps or bumps or rashes?
No.
Anything there?
Mm-mm.
Do you get short of breath at all with any
No.
of this? Or notice any wheezing?
No.
Do you have a cough?
No.
Okay.
Mm-mm.
And what about chest pain? Have you had any chest
Well, I
pain?
have. I just had a little bit of chest pain when
When that happened?
but just
okay.
but it went away when the pain went away.
Okay.
So
Have you ever noticed any kind of like palpitations or felt your heart kind of skip a couple beats? Okay. And then with your belly, you said it's epigastric pain there.
yeah.
And you really haven't felt this pain before.
No.
How about your bowel movements?
Perfect. I mean, no problem.
No change in there, no
No.
diarrhea, no constipation.
No.
What is your normal? Do you usually have one a day or
2 a day.
2 a
Usually.
day? Okay.
Uh-huh.
And is it formed?
Formed.
Usually formed.
Mhm.
Okay.
Mhm.
Have you noticed any blood or anything?
No.
In your
Uh-uh.
stool? Okay.
Mhm.
And then urinary, are you going to the bathroom there okay?
Yep.
Any urgency or frequency or incontinence? Everything's going okay there? And you said your pap smears have all been good, no history of STDs or
Right.
pelvic inflammatory diseases or anything
Uh-huh.
there. And then you said normally are your periods pretty regular?
Yes.
But you missed this last month.
Right. But I'm 45, so I just kind of thinking,
Okay.
you know.
Sure. And then usually how long do they last? Your periods, is it like 5, 7 days?
Yeah,
Okay.
5 to 7 days.
And we just describe it as like heavy or light?
No, very light.
Very light.
Mhm.
Okay. And then have you noticed any swelling or anything in your feet? Or
No.
any edema there? And then what would you describe your mood? Are you pretty happy?
Yeah.
Okay.
Yeah.
Any history of depression at all?
Mm-mm.
Never been anxious or had any anxiety?
Uh-uh.
Okay. Well, I think I asked you all the questions. Now I'm just kind of
Okay.
check out your
Got me to
your
get down?
systems here. Sure. You can lay down and I'll listen to your belly. Did you say you're not having any pain right now?
No.
Okay.
Mm-mm.
So let me just go ahead and just shut up there. And
Now
look
I
at your
have this
stomach.
thing going on, which is my thing. But
Okay.
It's
So
my
don't-
thing.
Just leave it alone. So let's just listen to your belly here first, okay? So, and I just hear normal bowel
Yeah.
sounds.
Mm-hmm.
Everything sounds good. Got bowel sounds in all 4 quadrants.
That's still a little tender.
Tender just right there
Yeah.
for me? Okay. Sorry. And then I'm just going to listen here to hear if I hear any breweries.
Mm-mm.
This side, this side. I'm just going to percuss your stomach, okay?
Okay.
Start over here where it's not so painful. And your spleen doesn't feel enlarged at all.
Okay, no.
That sounds like you have good sounds everywhere, timpani everywhere. That hurt a little bit?
Yeah,
You
just
can
a
go
little-
ahead if you want to
just a
pull your
little
legs up
tender.
to just kind of relax your stomach. There you go. Sorry. Okay. And then you said you got nauseous, huh? But you never
Oh, it
actually
was so,
puked.
no. I won't let myself puke. I didn't puke, but it was
Okay.
so nauseous.
And what do you mean you don't let yourself? You just get too...
I just breathe through it and
Okay.
try to.
So it's hurting you right now? I'm me pushing there?
Yeah, just up on the. Yeah.
Right up here?
Yeah.
Does it hurt worse when I let go there?
Mm-mm.
Just when I press down?
It's just tender.
Okay, right here more on the right? Or
On the right.
Not so up here, okay. Okay, sorry. Let me just see your leg here. I'm just gonna... Tell me if this causes any more pain here. At all?
A little bit.
A little bit? Okay, and then bend your leg for me. Just gonna kinda...
It's just tender, yeah. It's weird.
Go ahead and relax this leg and then push up against me. Does that make it worse at all?
Mm-mm.
What about this side?
Mm-mm.
When I push on this side here, does it radiate over to the other side at all?
Uh-uh.
Over into your right side?
Mm-mm.
Just gonna feel your lymph nodes, okay? Make sure there's no swelling here.
No. Everything seems to be fine.
Nothing here, no swelling. Okay. Go ahead and I'll help you sit up here. I'm just gonna listen to your lungs and your heart, okay? So just take a couple good breaths for me. And your lungs are clear throughout?
Yes. Mm-hmm.
I'm just going to lift up your shirt. Thank you. Stethoscope's a little bit cold, sorry. And everything sounds good here. Nice and clear everywhere. Good, good. And your skin looks good. Let me just kind of press here on your kidneys. And any pain here when I
No.
tap there?
Mm-mm.
Okay, let me listen to your heart. And your heart sounds good? No murmurs?
No. No.
Nothing there. Okay, and I'm just looking at your eyes, your sclera. I don't see any jaundice or anything. I don't see any veins here come down. No swollen lymph nodes, sore throat or anything down there. And then just check for any edema, which looks good. You look good there. Okay, so what I think, there's a couple things that could be going on. From the sounds of it, it mostly seems like maybe it's your gallbladder.
Oh, really?
And just from your eating that meal kind of makes me feel like it. A high-fat diet, you're female, you're in that age group of where your gallbladder kind of gives you a heck. So I'd like to do an ultrasound, and we can look at your gallbladder and make sure that's okay. You don't have a fever or anything, but I might do some labs just because I would like to make sure that you're not pregnant for sure, and possibly having like an ectopic pregnancy. Even though that's kind of on my least suspicious, I do want to do a pregnancy test on you. And so let's see what else I think we should do. I don't know if you and your boyfriend maybe if we could try and work on eating more vegetables and fruits and things, and you know, I'm sure you're busy with a 5-month-old and such, but decreasing your diet and things, your fat in your diet. So I'd like to do actually we could do a lipid panel on you and just make sure your cholesterol is okay. And the other thing I'm kind of worried about too is just maybe a little bit of peptic ulcer disease, maybe just with wine being consumed, you know, daily, and you know, your family history of pancreatic cancer and such. Just maybe check that out. Maybe too, we can, you know, I don't know if you feel like you're ready to cut down a little bit on wine, or if you don't feel like you need to.
If it would help, I mean, I don't want to ever go through that again. It was so intense. And,
okay. Until we can get you ultrasound scheduled, it would be very encouraging if you didn't drink wine and didn't have high-fat meal to try to regulate this pain. But we can do an ultrasound and rule that out.
So the mac and cheese is a high-fat food then?
Mm-hmm.
Is it?
Yes.
Okay.
Is that your favorite?
Mm-hmm. Okay.
So if you can try, you know, fruits, vegetables, more fiber.
Fiber, okay. Okay.
You know,
salads, things like that?
Mm-hmm.
Okay.
Exactly. Things different. And I'd like to follow up with you, you know, soon.
Okay.
We'll get your lab work and things, and we'll give you a call, have my nurse call you and make sure that everything looks okay. Let's see. I don't think, do you think we covered that, or do you have any suggestions for anything?
Well, just what if, you know, what if I have that intense pain again? Do I just call you, or before, I mean, when do you think the ultrasound can be done?
I think we can do it right away.
Oh,
I think we
okay.
should be able to get you
Okay.
in today or tomorrow.
So then we'll know if it's the gallbladder or if
Mhm.
it's like pregnant or something.
Exactly,
Okay.
yeah. So, you know, actually I'll have you go and get labs right now.
Okay.
And we'll do a pregnancy test
Okay.
right now.
Okay.
I want to be sure that that's not.
Okay.
And then the ultrasound I can get scheduled right away too.
So what do you do if it's a gallbladder? I mean, what?
Then we'll just refer you to a surgeon.
Oh.
And yeah, we'll have a surgeon look at it. And, you know, usually they most likely would remove it.
Oh. Okay.
If there could be sludge in there could be a stone in there.
Oh.
You know, with all the tenderness you're having,
Yeah.
just
Okay.
from me, you know,
Okay.
not even pushing that hard,
Okay.
I'm pretty concerned about your gallbladder. So,
Okay.
is there a surgeon you know in town that you would like to?
Mhm.
Okay.
Mhm.
So we have some good ones here at the
Okay.
clinic. So,
Okay.
yeah, we'll be, you know, following through with that right away.
Okay.
So,
Okay.
for sure, you know, in the meantime, we'll get all that scheduled. But if you have a fever,
Mm-hmm.
or you get chills, or you get that sudden pain, you can sure
Okay.
call me.
Okay.
You can, if that pain does not go away, I want you to go to the ER
Okay.
also.
Okay.
So, do you have any other questions at all? Okay. Okay, well, and I'd like to see you back. So, like I said, we'll get all these tests done, and
Okay.
we'll follow up with you and see
Okay.
how it's going, okay?
Good.
Sound good? And do you need anything, you think, for the pain if it gets
No, I mean, it
severe
seemed to
enough?
work with the
Okay,
rest
just
and
rest.
laying down and, yeah.
And you have enough support from your boyfriend
I
that if
do.
you need to rest,
Mhm.
he'll help you
Mhm.
out.
Mhm.
Okay.
Mm-hmm.
All right. Well, I'll have my nurse come in then and just draw your labs and
Okay.
get all that and do a pregnancy test and have her schedule you actually an ultrasound right away.
Okay, so what labs do you think
Check
you
that
might
out.
do then?
We'll do a pregnancy one for
Okay.
sure. I might just have you do a urine
Okay.
with that one. I also have you do just a urine test just to make sure everything's okay. And then I'll do a complete blood count, make sure that you
okay.
don't have any elevated white blood cells.
Okay.
And then we'll do a whole chemistry panel, make sure your liver enzymes are all okay. Your liver is also up there in your,
Oh, okay.
okay. Where you're having the pain too. You know, you're around bodily fluids and
Mhm.
things, so we should probably just do all those labs
Okay.
just to be careful. And then I'd like to run a lipid panel on you too,
Oh, for the cholesterol?
Yeah.
Okay.
just to double check it.
Okay.
Is there any chance that you could have been exposed to anything at work?
Mm-mm. No, I'm
Okay,
pretty good
you're
about.
pretty careful.
Mm-hmm.
Okay. Yeah, so we'll do all those, and I should have those results to
Okay.
you later today. And
Good.
we'll do that. We'll do your ultrasound right away too.
Okay. Okay. Well, I don't work for the next couple days, so that's good, I guess.
Okay, that'll be perfect. Okay, you be
Okay.
sure though if something comes up, you can either call here, or if the pain
Okay.
doesn't go away, it gets so severe you can't take
Okay.
it, that you come into the
I will.
ER. Okay.
I will.
Okay. Thanks, Sheila.
Thank you.